Next on Primary Care, good oral hygiene plays a major role in your overall health and well-being.
And what we're seeing right now too is that a lot of people coming in with inflammation from gum disease that is untreated for years, and we're finding out that people who have untreated gum disease have a 70% chance of getting pancreatic cancer.
Hello, I'm Dr. Lonnie Joe, and welcome to Primary Care, the show dedicated to improving the health and care of African Americans. Our oral health is an important yet often neglected part of our overall health. It's linked to disease, heart disease, diabetes, sleep apnea, and many other conditions. Here in the U.S., many adults and children are not getting the dental care that they need. Whether it's because care is unaffordable, there's a fear of the dentist, or just not making teeth and gums a priority until there's a problem. Whatever the reason is, regular preventive dental care has to become a routine part of our lives, so problems can be found earlier when they are easier to treat. Today we are pleased to be joined by Dr. Wendell Lawrence. Dr. Lawrence is a dentist with over 40 years of experience at OakDent Smiles. He has an extensive practice where he applies a holistic approach to dentistry, making certain his patients are in good health, beginning with their mouth. Dr. Lawrence, welcome to the show.
Welcome.
So pleased to have you.
So nice to be here.
Icon of dentistry in our community here. Dr. Lawrence, everybody sort of gets that fear factor going to the dentist. I don't care how routine it is or whether or not you've been many times or no times, there's always that little hesitancy thing that comes in. So what do you see as the connection between our dental health and our overall health?
Well, the mouth is the portal for all diseases and anything that happens in the body. And we see that 70% of systemic diseases have their we see them first in the mouth.
At least.
At least.
Yes.
The manifestation of the mouth is always first. Right. So the mouth is so important to understand that it's connected to the whole body.
Yeah, it's a gateway. I know in our office, first thing we do is grab a tongue blade and say, open your mouth. And
yes,
say, I mean,
exactly.
Right up front. So it's the gateway, it's the portal to what we're dealing with. So but diseases are prevalent, but what do you see in practice as some of the most common diseases that are associated with poor hygiene, dental hygiene?
Well, first we see periodontal disease, or gum disease as it's commonly called. It's so prevalent in the practice. I would say 75% of people have some form of gum disease. And people don't realize how important it is to keep regular visits, see the dentist, take care of their mouths so that their teeth can be healthy. Because without that supporting bone for the teeth, they will go away on you.
Right, decay, tooth loss, oral cancers.
Yeah, we see oral cancers. More and more now we're seeing more and more oral cancers in the mouth, especially among the younger people.
Yes,
the HPV. That's so common now.
Very common.
And that's what we see, and we see a lot of decay, a lot of sleep apnea, and we know that's connected to the oral space, the airway space, and so we see a lot of those things in our office now, and we can treat them.
So initially, a routine examination or a routine presentation for a patient has to include a history that says, do you have any of these other diseases present? And it all enters into what you actually do in terms of providing a treatment plan.
Yes, it is, because we have to observe that history carefully, and you have to sit down and talk to the patient. You can't be too busy not to converse with the patient and find out what's their history, what's their background, what are some of these things I see in the history here. And it tells the whole story of what's going on, not only in the mouth, but in the body.
In the body.
Yeah.
So most people kind of wait till it's hurting or there's an emergency. I mean, people don't necessarily rush to see the dentist until, especially if they hear the drill going, you know.
Yes, yes. There's that fear factor.
There certainly is there.
For many years.
So when we think about this, you know, we should be thinking about this before we have an emergency of sorts. But
yes.
When there is an emergency, how should it be handled? I mean, what should people be doing?
Well, first of all, if there's an emergency and there's pain, there's swelling, inflammation, fever, you want to come in to see the dentist as soon as possible. If it's very severe, of course, you go to the emergency room.
Right.
But if it's something that is gradually happening, please, we tell them, come and see the dentist. And they come in, and a lot of times when they come in, it might be a little late because the process of disease has already started. And so
that's very true because we tend to delay.
Yes.
In a lot of disease states. I know in our end of the business, we're hesitant to do certain things to patients. One in particular is open heart surgery, and people who have a lot of disease in their mouth. We're saying, boy, you really need to get this taken care of and before we actually start tinkering with your heart with a knife.
Yes.
And providing another type of service which can definitely be adversely affected down the road if we have not taken care of the oral care first.
Yes, that's so true. Because just a routine cleaning every 6 months will alleviate some of the inflammation that we find in the mouth, and just a checkup, some x-rays to see what's going on, because we know that the mouth is the portal for the body, and if you can see what's going on in the mouth, you know what's happening in the rest of the body.
It tells on you.
It tells on you, it does.
Yeah. Are there any particular disease states that might be found more prevalent in African Americans?
Yes, African Americans, or the African American community always has more periodontal disease or gum disease. We see that like 59% of African Americans have some sort of gum disease problem, and there are reasons for all these things.
As high as 59%?
As far as 59%. Yes.
3 out of 5?
Yes, yes. In the American public, it's huge also, but particularly people who don't have access to good dental care and are not coming in on a routine basis to see the dentist, or are not knowledgeable about some of the things they should eat and some of the things that they should be watching in there as they make their health a priority, especially their dental health.
So the phobia is there. How do we help people get over the phobia, you know? And unless the pain sits in, they always seem to be delaying that trip to the dentist.
Yes. Well, it all comes with training also. You sit down and talk with the patient in a very nice way and make things as comfortable as possible in the office. And we have so many new techniques now that are so much less painful, and focus on patient comfort and make the chair a relaxing atmosphere for them and a comfortable atmosphere for them, so they're not afraid to come in to see the dentist anymore like they used to be. So, but obviously if you have had a bad experience early in life as a child, it sits with you the rest of your life. So it's always good as children come in to have that good first experience, so they are not fearful of coming to see the dentist in the future.
So from a preventive standpoint of view, people should be seeing a dentist and building a relationship with the dentist. You should be seeing them, what, every 6 months or so?
Every 6 months. And if you have periodontal disease or gum disease,
more than that.
Every 3 months.
Does that help alleviate the fear? I know if you had a bad experience, it kind of sticks with you. But if you go in and if you got a good trust factor that you can build on, and you have a good experience, does that improve the follow-up appointment rate?
Yes, it does. We have what you call regular routine patients who come in on a regular basis, and they have gotten used to us, and it's like coming to a family. You know the dentist, you know the hygienist, you know the assistant, and this is like coming home and in a comfortable setting where you can get your teeth checked and cleaned and just alleviate any problems before they come up as an emergency. And
so we see a lot of business enterprises, I will call them, in all phases of healthcare and in dentistry also. I mean, the advertisements on television are legion. And sometimes it's like, and patients have expressed this, that I'm seeing the dentist of the day or who just happens to be covering the location that day. I'm sure that's better than not seeing a dentist at all, but does that present barriers in terms of care for patients?
Yes, because it's some of these places are like warehouses and assembly lines. You just go through and you're another person. And so you don't develop that relationship with the dentist or with the hygienist or with the office staff. And you come in when there's an emergency, or you come in and they don't treat you in a comfortable, relaxed manner. So people, they prefer to come somewhere where they are used to, and the pace is much slower, and there's more care and intense evaluation of what the need may be.
One of the things that we've seen for years is this symbiotic relationship between the primary care provider and a dentist. I'm looking in the mouth and I'm saying, boy, do you have a dentist? I'm saying, referral to a dentist, or the dentist is sending someone over saying, listen, I think this patient has diabetes, or this blood pressure is out of control while the patient was in the office today. How important is that relationship between a practicing dentist who's taking care of the individual or the family and the primary care provider?
It is huge. It's the only way to practice good dentistry, good medicine, is to have that relationship between the dentist and the primary care physician or the specialist or whoever the person is seeing, because as you say, the mouth has so many effects on the body, and many medications that people take for different diseases affect their teeth and gums and jaw. So we have to always check with in the age that we are in now, with all the hip surgeries, the knee surgeries, and all these different things, you have to be pre-medicated sometimes before you do dental work, or there's a waiting period after the surgery is done before the dentist can see you.
Right.
So we always have to check with the primary care physician and find out, or the specialist, and find out, is it safe? Does this person need pre-medication? And what are some of the contraindications for medications we may give them that would oppose what the doctor is giving them?
Probably a perfect example is people who are on blood thinners, and particularly some of the new blood thinners, where in the old days we would take people off of the old-fashioned drugs, for 10 days, 2 weeks before we would let them have any dental procedure. And now, we can do a little bit better than that. That's one area, but you're right. There are lots of drugs that we use that have to be paid attention to. That's why this communication and the relationship between the primary care end of the business and the dentistry end of the business has to be there.
Yes. I mean, we're finding out that some physicians or primary care physicians don't emphasize enough that relationship that needs to be there, and they don't give the patient instructions to make sure you let the dentist know that you are on biphosphonate.
Exactly.
Which is for osteoporosis, and that affects the jaw. It causes necrosis of the jaw, so we can't treat that person with extractions or some invasive procedures, because until they come off of that for a while. And some of these people have been on it for years.
I mean, I've seen it affect people who are attempting to have dental implants even.
Exactly.
And it's a real drawback and a barrier for them, simply because of their overall medical condition that's being treated.
Exactly.
We were talking about looking in the mouth and what we see. And a lot of times what we don't see is just as important as what we see. Sometimes the information is there simply because the dental hygiene is lagging, and that's an important factor in terms of health overall. That emphasizing the importance of those regular checkups, 3 or 6 months, and also talking about what that information means to the rest of the body. Here again, we've had patients in the past where the oral situation precluded everything else that we wanted to do, and I'm sure you see that every day in the practice.
Yes, we do. Dr. Joe, we see that a lot, because inflammation is the key to the disease process of the body. And it starts in the mouth a lot of times because of the periodontal disease or lack of routine dental treatment. And they come in and we see all this inflammation, and then we can sort of see why they're having all these other systemic conditions. And of course, we keep in close contact with the doctor and find out what the history of the patient. And we see that inflammation is the key, especially periodontal disease. When that inflammation goes through the lymphatic system,
Yes.
and goes through the body and affects the heart, the lungs, the kidneys, high blood pressure, hypertension. Diabetes is a key right there. It's maybe silent, but it's a key in good overall health and good oral health also.
Right. Right now, we're teaching medical students that if you've seen significant inflammation or disease in the mouth, suspect heart disease, suspect pulmonary disease, suspect kidney disease, because the inflammation cascade affects all of those organ systems and certainly can be a marker of what's going to happen in the future if you don't take care of that oral cavity.
That is true.
Go ahead.
And what we're seeing right now too is that a lot of people coming in with inflammation from gum disease that is untreated for years, and we're finding out that gum disease, people who have untreated gum disease have a 70% chance of getting pancreatic cancer. And people who in our office of patients who die from pancreatic cancer, we're finding out that they had an ongoing long history of gum disease every time. So that's a connection that's relatively new, but it's very huge.
So if we start talking about how we look at markers in the body, one of the things that we should be including in this whole workup of that patient is what kind of disease exists in the mouth, and then start thinking about what other organ systems, like the pancreas at least, can be affected by that.
Exactly. And we see that all the time. And patients who have pancreatic cancer, they tend to not want to let you know they have it. And so you talk with the primary care physician and he lets you know that, yes, this person was diagnosed with pancreatic cancer, and we see the connection. And then they admit it. And then we find people who have hypertension, high blood pressure, that plaque building up from the inflammation through their body, and their vessels, and the hypertension is there. And then the drugs they get for the hypertension, a lot of times affect the gums.
Excellent.
And affect the teeth, and the teeth are always bleeding. And so it's just a relationship that's always there. And inflammation is the key source of both dental problems and systemic problems. So it's like an oral systemic link.
Yeah, I mean, connecting the dots.
Yes, yes.
Outside of oral cancers, what do you see the folks of smoking in terms of how it affects the teeth and the gums?
Well, it makes gum disease worse and less treatable when a person is a heavy smoker, because the gums don't respond too well when to hygiene treatment or gum treatments that we may do for persons a heavy smoker. And we also see that happening also for people who are alcoholics. Now, there's some people who are called functional alcoholics.
Yes.
And they work every day, and they go to the bar after work, and they go home, and they're functional alcoholics. Sometimes their family doesn't even know they are.
Right.
And they're functional. We had one guy came in, and we did an extraction, and he was bleeding so much after, and then he never put in his history that he had any problems. Everything was perfect. And then I sent him to he didn't have a physician, so I sent him to a primary care physician that we use for the office sometimes. And he says, "Why don't you tell me this guy was an alcoholic?" When he came, I said, "He never said that." Yes, and he was.
Probably had liver disease.
Right. That's why the bleeding continued and continued. And he got it under control, and he was a happy camper after that. His wife was also happy.
I'm sure. Let's shift gears here for a second. You have been diligently working at this craft and concerned about community involvement and community improvement in terms of oral health. Tell us about the Amen Dental Clinic that you operated for some time now.
Yeah, well, I'm a member of the Amen. It's an acronym that stands for Adventist Medical Evangelism Network. And it's a national organization. In fact, it goes, some of the countries around the world have chapters, even down in the Caribbean. And it's a large organization, and their primary focus is to go to areas where people are underinsured, where people are undertreated, people are marginalized, people are in inner city areas where they don't have much resources for medical or dental health. And so the Amen organization gets with these clinics, and we hold a clinic almost every weekend, all through the year when the weather is good. And so there are 10 clinics in Michigan this year that we're going to run. We ran one in Detroit very recently, and that was really very successful. Saw over 300 people that day, and there were people waiting. We had to turn back some people, unfortunately, but it was a good service, and it really helped the community. And people that just don't have the resources and don't have the ability to see a dentist on a regular basis, and they're all free medical, optical, dental. Then Amen also helps physicians and dentists and other healthcare professionals to integrate with the community and train them how to bring a message of health, healing, and hope to people, because that's what they need most of all.
So there was a spiritual side to this event also.
Yes, there is. Very strong spiritual side.
So what kind of services did you provide that day, just from a dental standpoint of view? Were you able to actually do more than exams, or were you able to do cleanings and extractions and those kinds of things?
Yes, we were. We had probably 15, 16 hygienists and 25, 26 dentists, and we have 4 or 5 physicians. And we were able to do extractions. People who've been hurting for months, able to do cleanings. Everybody who wanted to could get a cleaning, and we were able to do fillings. And we had an oral surgeon who volunteered to be there, and so we kept her busy.
How about that? The disparities that exist throughout healthcare does not exempt dental care at all. We see them every day in terms of the challenges that people face to get this kind of care. What has been your experience in terms of trying to overcome some of these disparities?
Well, first of all, dentistry is probably the last thing on some people's agenda. They're afraid of the dentist in the first place, and then dental care it can be rather expensive, especially when you don't treat your teeth on a regular basis. When you do have to get care, it's expensive to take care of it. So, unfortunately, in the African American community, dental care has not always been go-to or the first thing they think about when it comes to health care. And so we try to educate people and give back to the community, and especially as kids, as they grow up, if you educate them to bring their kids in early, and so they can get a good foundation of brushing, getting their teeth cleaned, good dental hygiene. It sometimes motivates the parents also.
Right.
And then it builds a well-trained patient for the future who takes care of their teeth and a healthy overall person.
We believe that the tide should automatically raise all boats. I mean, we did a health fair not too long ago. I mean, I was pleased to see the diversity that the health fair represented, but at the same time, I'm saying, boy, this disease state is no respecter of person.
No,
okay. I mean, we saw a heavy population of Bangladesh people, Hispanics, and including African Americans. I mean,
yes.
so, and you know, it makes you feel good about spreading the resources to some degree. But here again, you know, we still have a lot of work to do. Besides that, approach is heavy lifting. We need to be more involved in terms of what resources need to be brought to these situations, more than just the individuals that are doing it. You know, what's happening on the horizon in terms of interacting with the state of Michigan, health departments, and Medicaid services? What's happening in that dental arena?
Well, they are becoming more aware of to treat patients and to treat the public and the communities on a whole. You have to have a presence of, first of all, inclusiveness, and then a presence of care and understanding of the needs that people have out there. And so they have what you call a healthy, from the state of Michigan, Healthy Michigan plan, which sort of partners with Medicaid. And we're seeing a lot of different healthy programs setting up for kids and for adults, where they can get free services. And it's available to all inner city communities, and that's huge. And then we see people who are also more interested now in checking the water to make sure there's enough fluoride in the water.
Yes.
Because that's huge. Some communities don't have as much fluoride as they should have.
Right.
So they're making steps in that area. And we are also making steps in oral cancer screenings in the different churches in the inner city, where we can screen them and find out things that are going on. And we partner with like Henry Ford Hospital and some of the larger hospitals who do screenings for prostate cancer, breast cancer, and all these different things. And we do oral screens at the same time. So it helps to make the community aware that cancer doesn't discriminate
Absolutely.
on anyone. Everyone can get it.
Yeah. We live in a instant society. Everything's done quick, including fast food. What are the dietary impacts on oral health? Simply because sometimes your problem is what you're consuming.
Yes, that's true. And most people are on a limited budget, so they go for things that are cheap. And sometimes the best food choices may not be in the things that you can, like the fast foods that you can get. And it affects it, especially high sugary foods and high fat foods. They're not the best for the overall health, and especially for the teeth. And when people drink a lot of pop, they sip all day. The saying says, sip all day and get decay. You know, snack all day and have a
How about that?
have a tooth attack. So we have to be careful with the sugar and the acid that's in the pops, the soda pops that we drink, and the sugary contents of some of the foods. Like I had a program in the inner city schools, and which we do career days every couple of times a year, and I take a lot of cereals from all different kinds of cereals.
And look at the sugar content.
Yeah. And we want to focus on the sugar content, and I mix them up. So I said, what cereal do you like the best here? And then they would choose the things like Fruit Loops with marshmallows. And you know that sugar content is almost 55%.
Right.
And was some of the better cereals or more healthy cereals they wouldn't choose. And so we just have to educate them. And things are starting to change in the school system. And it certainly helps to get out into the community and educate people.
Dr. Lawrence, we have several more questions, but we're out of time. We could do this for another hour, tell you the truth. But thank you so much for joining us on Primary Care today. This has been enlightening, and I'm sure that this is going to open a lot more mouths so that we can continue to take care of them. Thank you so much.
Pleasure to be here.
Good. Our guest has been Dr. Wendell Lawrence, dentist and CEO of OakDent Smiles. The best way to maintain good oral health is to follow tried and true dental care practices. Brush your teeth twice a day, floss every day, and go to the dentist on a minimum of twice a year to have your teeth cleaned and examined. For Primary Care, I'm Dr. Lonnie Joe.